What is more important, how much you smoke or how long you smoke? The duration matters more than the amount. So if you smoke 20 packs of cigarettes over 10 years, and so it's 20 times 10, it's 200 pack years, that's pretty bad. Or you can smoke 1 pack for 20 years, also 200 pack years, but the 1 pack for 20 years is higher chance of getting cancer than the other way around. So duration matters more than the quantity. And then the best thing, of course, is not to smoke and at all, or to stop smoking once you are smoking. And what's interesting also in the cancer that we now see in lung is mainly non-smokers. So half the cases that we see in California are non-smoking people. In fact, many of my patients who are Chinese women who have lung cancer never smoked. And nobody in the family smoked. So it's not even secondhand smoke. So we really don't know why they have lung cancer. Lung cancer is evolving. So smoking is far, and even those who don't smoke, you wouldn't have prevented the cancer. So that's why as lung cancer is evolving very rapidly. Next slide. And the lung cancer in white people and in Chinese people are very different. Chinese tend to be what they call EGFR mutation positive, which means that they are more likely to respond to oral medication. That's a drug called Iressa. Iressa was about 10 years ago. It's a pill. The pill go against this EGFR. EGF is something your body makes. It's called epidermal growth factor. And EGF is made by your body so that you can renew your lining of your mouth, your eyes, your GI tract. So the cancer figured that out and have become ultra sensitive to EGF. So it's something your body has to make, and it will make more receptors so it has growth advantage over the normal tissue. And because of that, Iressa was developed to block this interaction. And sure enough, it worked in Chinese and Japanese, didn't work in Americans. So in Asia, the response rates are 50%. 50% of people only take this pill as a single treatment, and it works in them. In America, the same number of people take it, only 10% respond. So because of that, the drug has been withdrawn from the US market, but is now being used extensively in the Asian market. And that's another drug that Americans have come up with called Tarceva, which is similar, which kind of closed the gap between the two, but the drugs do the same thing. And that's why Tarceva is used in the US and Iressa is used in Asia. I still remember going across Star Ferry from Hong Kong Harbor. They have a big sign advertising about Iressa. And next to the Lingji mushroom. The Lingji mushroom one is bigger though. So, and what's interesting about lung cancer in Asian people is that it happens in young people. It doesn't happen in the old people. I mean, young is basically, we're talking about under 30, under 40. So that's very scary. We don't know why they have it. And some people think it's from the gas cooking, but it's not really, I don't know. But they get them here too, and that's not a big part of it. And most are non-smokers, but the Chinese people have better prognosis than the whites. Next slide. And so now there's a lung cancer screening, but the problem is this all is based on smoking history. So you're not a heavy smoker, you don't qualify to have a lung cancer screening. Okay, the idea is that if you do lung cancer screening between age 55 to 74 and was a heavy smoker, there's a much better chance we'll find the cancer early. That's the whole idea behind the study, which showed this. And this is formed the basis of the recommendation. But if you don't smoke, then you're not going to do this. And it probably will not be effective in picking it up. So it's very restrictive. Age 55 to 74, heavy smoker in the past. These are the people who would be qualified for the screening program. Next slide, please. And okay, so now we're going to switch gears. Infectious disease is a big problem in China and Asia in general. And there's quite a few of these cancers that we see is direct result of infection. For instance, cervical neck cancer in women. This is the cervical neck is that outside area where the uterus is on top and the cervix is in the vagina. And HPV infection has been linked directly to cervical cancer. In fact, we think that if everybody got vaccinated by HPV vaccine, you reduce cervical cancer by 90%. So it's that strong a causing factor. And for some reason, in the Vietnamese population, it's the highest in the whole of US. is Vietnamese, and many of them are also Chinese. Now, is it because it's an educational issue or a cultural issue? We still don't know entirely. But they have the highest rate. But it's rare. It's almost unheard of in white Americans now. And that's why you do pap smears. So pap smears will pick up cervical neck cancers. And so by doing HPV vaccination, you will decrease the need for that. A second one is something called Helicobacter pylori. Now, this is a parasite. It's in your stomach. We think it's been around for 1,000 years. It's not a new thing, it's just that now we learn about it. And they found out that in Asia, there's a much higher rate of Helicobacter pylori infection than in the US. Although in the US, we're finding them more too. So if you don't look for this, you never find it. So people have to look for this. They usually do it, the best way is by endoscopy, looking for it. A lot of people come in with stomach problem, that feel like reflux or ulcers, symptoms or bleeding, and then they find this, and that's how we figured it out. And even in Asia, there's an interesting problem. We found in India, for instance, the rate of H. pylori infection equal to that in China, and in Korea. Korea is the highest in the world, but in Korea also the highest stomach cancer in the world. But in India, it's almost no stomach cancer. So why is that? So a lot of speculation, is it the diet or is it because of the strain? It turns out the strain in North Korea is similar to the northern China. It's a different strain than the one in India. And that's been touted as a reason why you get stomach cancer in Korea and Japan and you don't get it in India, even though the rate of H. pylori infection is the same. Another one is a nasopharyngeal cancer. Epstein-Barr virus and HPV have both been linked to nasopharyngeal cancer. Nasopharyngeal cancer is also very interesting. It's mainly in southern China. You don't see it in northern China. So if you look at the map in China and look at the number of nasopharyngeal cancer cases, it's very few in Harbin, very few in Beijing, but once you get past the Yangtze River, it starts to increase. And it really reached a peak in Guangdong, Guangzhou area. Yeah. And the whole coast, yeah. Why is that? It's not entirely clear. Is it the strain of the Epstein-Barr virus, or is it the diet? The Chinese thing is the diet, but I'm not so sure. And then finally, the hepatitis B, again, it's common, it's everywhere. But even in the US, we get liver cancer here, but the liver cancer here is very different than liver cancer in Asia. The liver cancer here is all from cirrhosis, from drinking alcohol. In China, people don't drink that much in comparison. And so their hepatitis B is the cause of the liver cancer. Next slide. So this is cervical neck cancer. We're talking about the infection in this area. This is largely a curable disease. We find it early. And so that's why we do pap smears in women. But after 50 years old, pap smears really are not very helpful because most of the women don't get cervical cancer by 50 years old. Next slide. Okay, so a little bit more about this. And we think that HPV is very, very common among young women. And a lot of this is spread by sexual contact, but doesn't have to be. So what happened is that we can usually find this. The reason we know HPV causes this cancer is because we find the HPV virus gene in the cancer gene. So we know that that's how it got started. And this is a big public health problem, but I think that we have an answer to that, is to vaccinate every young woman for HPV.
It's different strains. The Asian in HPV, the strain is different.
Ah,
yeah.
Does the vaccine work?
Type. Yeah, it's different type.
But the vaccine work?
I don't know about the vaccine.
Okay. Yeah, because I think that's the best way to fight this disease is you're not going to have people stop having sex. So so the best way to do it is to vaccinate them before they do that.
It's, so that's covered by insurance?
It is in the U.S.
So you can request?
Yeah. Well, it's routine now. I think it's offered for most primary care.
For age 9 to 11.
Yeah, young
For 9 to 11. For girls and boys.
Right. And
Boys
boys too.
11.
Boys
Yeah.
too.
But boys is been offered to have it.
Right.
Because it's a sexual disease, so you need to have it in girls
But they get spread it
and boys.
to the other people.
So if you pass that age, it's not...
Well,
you
the best
should-
time to do it before you start
If
becoming
you
sexually
didn't
active.
do it, you can do it. I mean, if your primary care doctor, they look through it, if you didn't have it, they will offer to you.
Yeah.
Oh, okay.
It's a routine
It's
thing
one of
now.
the health
Yeah.
maintenance.
Yeah.
Mhm.
So actually, with Obamacare, more
Don't
people will
think
be
that most
covered,
doctor will-
and more the young people will get
Talk to
vaccinated.
your primary
Yeah.
doctor, they should.
So we haven't answered the question of getting that implemented in the Chinese population. We'll make sure everybody does this. Next slide. And so, most of the time when you find it, it can be cured easily without major difficulty. And a lot of times even just a local, and they can burn it off with just minor surgical procedure. So the best time to vaccinate it is before it becomes sexually active. And usually you have to have 3 doses to get the maximum benefit. Okay? And of course, use condoms help. In Chinese, 75% of the women have gotten pap smears. And so that's good. But in Latinos, it's 79%, and in white women, it's about 80%, 85%. So we really want to get to 100%, but that's about where we are today in California. And this one is interesting, just for comparison, the number of cases per 100,000 people. In white people, it's 7 cases. In Chinese, it's 5, but in Vietnamese, it's 14. So 3 times as much. So this is for information. Next slide. Okay, so this is cervical cancer screening guideline. You should start doing pap smears at age 21, and then after that, every 2 years. And if you've done it for 3 times in a row that didn't show anything, then it's, you can get it less often. And then now there's a test called HPV DNA, so you can do that too. It's done with the same time as the pap smear. It's a very sensitive way to pick it up. All this stuff is considered routine preventive care. So it's covered by almost all insurance, like Obamacare mandate this kind of thing to be done. And then of course after you find, you finish doing if you have the cancer, you surgerize it, you just need to keep checking. But usually very few relapses. Next slide. Now, next thing I'm talking about is stomach cancer. This is the stomach, this is the esophagus coming here, the stomach looks like this, and they go into the small intestine. Most of the cancers are along here. Next slide. Okay, H. pylori is a parasite. It's not a virus, it's a parasite. And it lives in the lining of the stomach. It's one of the few few organs that survive high, strong acid. The acid in the stomach is really powerful. If you take out the stomach acid and you put a spoon in there, it probably melt the spoon in a few days. It's like sulfuric acid, it's really powerful stuff. And so this thing can survive in that environment. And the reason why we think this causes the problem is because the parasites stimulate inflammation. And the inflammation stimulates more division and in the cells of the lining of the stomach. And that's what increases the chance of getting the stomach cancer. So I've seen quite a few cases of Asian people who have stomach cancer. Now, interestingly enough, they do better than the whites. I think that cancer tends to be more superficial, particularly in Japan. Not so much, it's not so clear in China, but China we just don't have enough good data. But in Japan, they have a kind of stomach cancer that's very common. It's more superficial and it's easily curable. That's different than the one we have. Now, if you find you have H. pylori, which about, I don't know, around here, maybe 10% of people have it, there's treatment for this.
How do you find it?
Yeah. Huh?
How do you find it?
Usually, one of 2 ways. Either you have a stomach problem and the doctors do an endoscopy, and then they routinely do a scraping and they look at it. Number 2 is do a blood test. Blood test not as reliable though. That's the problem. So just because you've been exposed doesn't mean you have the problem. If you have it, there's a combination of antibiotic, H2 blockers, and proton pump inhibitor, and you can take that for about a week and that'll get rid of it. So definitely it's something we look for now and routinely. I got an endoscope and I don't have it. So anyway, what happened is that this causes atrophy of the stomach, and because of that, it actually increases the risk of stomach cancer. Next slide. Personally, now 10% of the people with stomach cancer in Asian have a family history. So we think that there is a gene called CDH1 mutation that we have found to be associated with this. Now it's extremely rare elsewhere, but it's probably fairly common in Asians. We don't know that. Again, in Asia, we don't have a lot of good data, so we don't know how frequently this is. One of our international fellows did the research on this, Dr. Jiang from last time when he was here. He described several families that have this in Beijing. And so it's because the reason why this happens is because of it stimulates an immune response, and that causes the stomach to become atrophy and to lose the acid production, and then the body would then try to stimulate the stomach to make more acid, and that stimulation is what causes the stomach cancer. It's increased turnover. So anything in your body that increases turnover increases the risk of cancer. Okay, next slide. So anyway, the other thing is, does preserved food or high would causes stomach cancer? It's very complicated. It's not entirely clear. So diet alone is not usually enough. Eating fresh fruits and vegetables is always good, but that's good above everything. And that's why we serve fruit and vegetables. And we lower the risk. People talk about green tea, and it turns out that it helps the women but doesn't help the men. Interesting. Why that happens, I don't know. And smoking increases by about 40%. If you're an ex-smoker, it's about 60% if you're a current smoker. So smoking interact with this kind of problem. Next slide. And so, someone who has H. pylori is about 6 times. So compared to smoking, compared to food, those things are relatively minor. If you have HPV infection, the risk is about 5.9 to 6 times more than if you didn't have it. So these are the very high-risk countries: China, Korea, and Japan. The highest is Korea. And then the lesser ones are Malaysia, Singapore, and Taiwan. To the world, India is very rare. Bangkok in Thailand is rare. New Zealand and Australia is very rare. So even though the HPV rate is not too far apart from country to country, not everybody who has HPV will get it. Next slide. Okay. And it's been around 1,000 years, and there's a big difference between people who live in the city than in the farm. People who live in the farm country is probably much more likely to have this infection than people who live in the city. 40% of the population, this is in Asia. Compared to here, it's about 10%. And then younger people is less and older people is more, so why is that? We still don't know, but that's what we found. And in industrialized countries, only 35% at the most, and in developing country, it's 85%. So poor country, rural areas are much more likely to get this. But here, because we have people who come from all over the world, many of them do come from rural areas directly to the U.S. That's why we're seeing cases more now than ever. And so, the difference we think is a different strain. So it matters where you come from. If you were living in southern China, you're probably less likely to have it than if you were coming from northern China. Next slide. Okay, now we switch to gear about nasopharynx cancer. This is a really rare cancer in the U.S. In the U.S., it's 0.6 cases per 100,000 people, and in China, it's 10.8 cases per 100,000 people. So it's a huge difference in rate. And then within China, there's a big difference from northern to southern. The difference in the north is 3 per 100,000. In Guangzhou is 20, 7 times as much. And then along the, there's actually the highest, I think, is in the Pearl Delta region in Guangzhou, near Hong Kong. Now, there's a lot of speculation of why that is. Is it industrial pollution? Is it the kind of food they eat? Or is it the strain? We don't know. But that's the highest, even in Guangzhou. Next slide. And what causes this? Epstein-Barr virus is actually a very common virus. We don't really know how often it is, but this virus has been known to cause Hodgkin's disease, maybe lymphoma, but in Asian people they cause nasopharynx cancer, and in Africa they cause jaw tumors. So same virus, different sites in the world, different disease. So very interesting. And oftentimes you catch it when you're young, the teenage years, kissing your girlfriend or boyfriend. Yeah, that's what usually causes that problem. So it's hard to tell people not to do that. And especially this kind of nasopharynx cancer is very sensitive to radiation. So most people can be cured, even advanced cases. However, sometimes the people we see are kind of older, so sometimes the treatment is not so easy to tolerate. But I've had several relatives who have this, and they've done very well with the radiation. And this is this kind of nasopharyngeal cancer related to EBV are the predominant kind in China. Okay? So this will give you an idea about nasopharyngeal cancer. This is from a study in China about what you should eat. And they found out, okay, relative to if you're a kid and you eat a lot of hamyu, okay, if you eat it every month, your chance is about 2.4, and if you eat it every week, it's 1.57, okay? Yeah, so it's both elevated than if you don't eat it. If you eat the salted vegetable, also there's not much of a difference if you eat every month, but you eat it every week, it was the 1.8. So if you're an adult and you eat the same thing, you also see a risk about double the risk. In contrast, if you eat a lot of fruits and vegetables, then you don't get it. So if you don't eat the yaham choy or the lapchang, you probably do okay. So this is an interesting one. This is about lap yolk, okay? So 8 times to 12 times higher. It's really scary. I mean, I don't know how accurate all this data is. I just dug this out of an interesting article just to show that it's a real thing. And this is, I think, from a study in Guangzhou. Yeah, next slide. So, you know, they also looked at Chinese cha, you know, the herbal tea, in Guangzhou, and that seems to have a protective effect. And then Botong, slow cooking soups, it's also protective. You know, like 0.44 means there's a 56% decrease in risk compared if you don't do that. So Botong Tong and Botong cha. Okay, next slide. Okay, now liver cancer is more complicated because that's hepatitis B. Liver damage in Chinese people is caused by hepatitis B. In white people, it's caused by drinking. Okay, just remember that. So very different diseases. And most of the time, the infection starts when you're a kid. And so right now in the U.S., we vaccinate all the children routinely. Now they don't. In China, I asked them, do they do that? They do it, I think, if you can afford it. But in Taiwan it is, but China is not. So there's still a pool of people, large pool of people who's going to have this. It's going to take many, many years before that gets taken care of. Next slide. And so to give you an idea, in America, compared to white people, among the men, the cases rate is about 22.1 per 100,000 per year versus 8 cases in white people. In women, it's about 8.5 versus 2.9 in white people. So the ratio is about the same for men and women, but the rates are a little bit lower for women than for men. But there's no question that compared to white people, it's about 2 to 3 times the rate. So that makes it, and then also the rate of death is also twice as high for Chinese people than Americans. Why is that? It's not entirely clear. But what's interesting is, this is very interesting, about liver cirrhosis, the gangyang fang. And so what happened in white people is 9%, 9 cases versus Chinese only 3 cases. So the difference is like 40%. So the Chinese have much fewer cirrhosis, but they got a lot more liver cancer. So the problem is hepatitis B. Okay, it's not just the cirrhosis. Hepatitis B can cause cirrhosis too. Next slide. So they call it the silent killer. This is what the virus looks like. Next slide. And it started to be a very, very widespread disease. 20 million people throughout the world. Some people estimate as much as 1 out of 3 people in the world can have hepatitis B. So and especially, but most of them are not in the United States. They're all somewhere else. Next slide. And so different strains of the hepatitis B also affects chance of getting liver cancer. And so, like for instance, in Southeast Asia and Sub-Saharan Africa, the risk is very high. In the middle risk is the Mediterranean countries, Japan, Singapore, and India. And then the Western countries is very, very low. So this is the frequency of hepatitis B infection among those countries. So you can tell this is really a disease in the Southeast Asia and Africa. Next slide. And it's no symptoms. That's why you don't know. And most people who get hepatitis B do not become jaundice, don't have pain, don't have anything. So, but they can die because they develop cancer, they can develop liver failure, or they can have cirrhosis. Okay, and in Asian people, the more people die of the cancer than they do of cirrhosis. Next slide. So the 5-year, what's the chance of you getting something bad? Like if over 5 years, if you have hepatitis B infection, the chance of getting cirrhosis is 10 to 20%. Chance of liver failure is about 20-25%, and cirrhosis giving you death is about 5 to 15%. So hepatitis B is a big deal. And what can you do about it? You know, most of the time you cannot do surgery. You know, sometimes you can. If you can take it out, that's the best. Usually it's a single lesion, but it depends on the location in the liver. If it's in a bad part of the liver, you cannot remove. Then your only option is perhaps a liver transplant. Now, liver transplant is not easy to get. On average, it takes 1 to 2 years to find a donor, and which limits the ability. People talk, oh, couldn't I just cut out most of the liver and then it'll grow back? Yes, but it might take you 20 years to grow back. So it's not realistic. So if people think, oh yeah, I can grow a new liver, it's not going to happen. Not in a lifetime. Next slide. So this is the 5-year survival rate, someone who has active hepatitis versus someone who has liver cirrhosis. So liver cirrhosis is a bad thing to have. Next slide. And people who get hepatitis B when they're young do better than when who gets it when they're older. I think something about the young people that they don't have as bad a reaction to this problem. Next slide. And so what can you do about it? You know, I'll skip this. Next slide. So the best thing is to prevent infection, and then you try to prevent cancer and try to prevent liver failure, and of course you want to prevent acute hepatitis because that causes damage to the liver. Next slide. Okay, I'm going to skip this. Next slide. Next slide. Okay, so this will give you an idea about breast cancer. Now I'm going to switch gears to the last topic, breast cancer. This is, the American line is up here. It's actually dropping over time. This is 2007. In contrast, Japan, this one is, let's see, which one is this?
Philippines.
Philippines, just China, Korea. All these lines are on an upslope. So we think that in another 10, 15 years, it may be getting closer and closer to what the American rate is. And it's a huge problem because it affects the women, but it affects the family. It's expensive. You know, there's a lot of things involved in treating breast cancer now. Hopefully by the time 10, 15 years from now, we'll be doing mainly medical treatment and not so much surgery. Next slide. But until then, it's still going to be a problem. Now, the number of cases in China is 75 per 100,000 women, compared to China, America is 153 per 100,000 women. These are all corrected for age. However, this has doubled in 10 years. So 10 years ago, this was about 40 something, and now it's 75, so it's probably even higher. And the age of onset is what's really intriguing. Okay, most Asian breast cancer, I would say about half are under age 50. In contrast, for white people, only 25% under age 50. So you have a different group of patients. Okay, now why is this? We don't know. Is it? First we thought it was just because they're immigrants. We get a very different population, but we find similar things in Hong Kong and China and Taiwan as well. So it's not just here. And interesting enough, the survival rate is better than whites. Again, same theme. That we do better, but we're catching up. And the people who come to the U.S. as immigrants, the longer you've been here, the more likely you're going to resemble the white women in America. So why is that? Is it diet? Is it, living style? We don't know.
Stress.
The survival rate is the Asians are better than the Caucasians?
Yes. Yes. We do better.
Okay.
Yes.